Hi, good afternoon. In this short section, we'll be looking at interesting case scenarios in HIV case management, uh, kind of a revision for our students preparing for their semester examination. So we're going to make a lot of revision and using these case scenarios. And I advise you to pay closer attention to these case scenarios because you might likely going to see them in your exams. All right. Okay. The first case scenario we're going to be looking at is one Mrs. Ebuna. She's 33-year-old woman and she is in her second pregnancy, like she's having the second pregnancy. So she came to your clinic for the first time for antenatal care visit. And she came as at when she was 20 weeks gestation gone. During her history taking, she reports having had multiple sexual partners in the past year, and she admitted that she have not been using condom. So looking at her from your physical assessment, you know that she appears very anxious and express concern about her health and the health of her baby. Now, based on this information provided, what are the key risk factors for HIV and other sexually transmitted infections? That is sexually transmitted infections as STIs in Mrs. Ebuna's case. That's the first question. Then describe the essential steps as a true you can take in providing antenatal care to Ms. Ebuna, including appropriate texting, counseling, and interventions. And the second question, explain the importance of partner involvement in Mrs. Ebuna's case, care, and also state the strategies that you as a healthcare provider can use to encourage partner testing and support. So that is the first question. Okay. Now let's take the first question. Based on the information provided, what are the key risk factors for HIV and other sexually transmitted infections? One, from the case we are given so far, first risk is multiple sexual partner. Here, Ms. Ebuna has reported having multiple sexual partners in the past year, which significantly increases her chances of being exposed to sexually transmitted infections. So therefore, having multiple sexual partner is a risk. Another risk is she is not using condom. Inconsistent use of condom is a risk because since it's not using condom during the sexual intercourse, it actually means that Miss Ebuna will have a greater likelihood of contracting any of the sexually transmitted infections, including HIV, but not limited to that, hepatitis, syphilis, and all of that. So it's another risk. Then another risk is what we know as demographic risk factor. At such age, Ms. Ebuna, she falls within the age range of women of childbearing age. 15 to 49 years of age. And therefore, she is considered as having a higher risk for both HIV and STIs. So women within that age group are actually being influenced by economic and social factors. So as such, they have greater risk of being exposed sexually, and chances of getting the STI is always there. Another risk there is that Ms. Ebuna is a woman, and therefore she's at increased risk of HIV acquisition from her male sexual partners, since all women are considered biologically more susceptible to HIV infection during heterosexual intercourse. Because of how their genitals, they are at risk of receiving the seminal fluid, they are at risk of receiving the sperm. So she's at increased risk of having HIV and other sexually transmitted infections. So another risk that Ms. Ebuna is exposed is what is known as obstetric risk. Now, this is a second child, or second pregnancy rather, and pregnancies have a unique risk associated with them when it comes to prenatal care and vertical transmission of HIV. So that is also a risk. So she has a risk of transmitting the same STIs to the baby, especially those STIs that can cross the placenta barrier easily. So she has a greater risk of actually passing it to the offspring. Now, looking at her history, she revealed, she is not visiting the healthcare system often. Given that she reported to your facility when she's already 20 weeks gone, that's a sign that she doesn't visit the facility often. So, which means that she has not started early. And therefore, regular assessment of her condition as a pregnant woman is not there. So that exposes her also a risk of having an STI that can even lead to abortion. Also looking at her too, she expressed anxious. She's very anxious and has concern, which maybe she's scared that the disease can get to the baby and all of that. So she is already exposed to a risk. So now let's take the next question in Mrs. Ebuna's risk. I'm sorry, anxiety. I'm sorry, case scenario rather. You know. Now, let's take the next question. It says, describe the essential steps. Describe the essential steps. The essential steps that a CHU can take, and describe the essential steps a CHU can take in providing antenatal care to Mrs. Ebuna, including appropriate testing, counseling, and interventions. So that's the next question we're going to look at now. So looking at the second question, the first step a CHU should take in providing antenatal care to Ms. Ebuna include one, thorough history taking. You should actually take a thorough history of the mother, including the chief complaint, past medical histories, past obstetric histories, past gynecological histories, and other histories. All these histories need to be explored and documented, including her sexual history. Then psychosocial background. Who lived with Miss Sabre? Is she married? Does she have a child at home? What type of work does she do? All this needs to be ascertained. Then we need to also investigate or probe further into knowing about sexual history. She have already told us she has multiple sexual partners and all of that, fine. But we need to prove forward to also know whether she engaged in other sexual behavior, such as anal sex and all of that, oral sex and all of that. We need to really understand all of this. Then we'll move into physical assessment. You need to physically examine the mother. Remember, she came for antenatal care. You have to take the history, you have to examine her, you have to conduct adequate examination. You have to actually examine the growth of the baby, the position, and all of that. And also send for radiological investigations too. So that's the scan. You need to send for scan too. So every other assessment that is required for a pregnant woman who comes for antenatal care must be conducted. Must be conducted. You have to assess the growth of the fetus in utero. You really have to assess that. Then you also have to do other routine blood screening, such as syphilis screening. You have to really screen for syphilis. Then also do blood type and rhesus factor test. Then you also have to perform complete blood count. You need to check the neutrophils, eosinophils, basophil counts, monocytes, macrophages, lymphocytes, and all of that. You need to do a complete blood count. Then you move into HIV counseling and testing. You need to look into HIV counseling and testing, and where you're going to carry out voluntary counseling and testing. You have to tell the mother about HIV and the need to be screened. And since she have already confirmed to us that she had multiple sexual partners in the past years, and she have not been using condom. So there's greater likelihood of HIV exposure. So you have to really talk about the HIV counseling, pre-counseling informations. We need to talk about the pre-counseling informations. Well, we'll talk about how HIV is being transmitted, the importance of texting, and the importance of finding out the status and its contribution to the fetal growth and a better pregnancy outcome. You have to let her know all of this and the information. Then you now test. You now test this woman to know her status. Then also you must also carry out post counseling test. You need to talk about post counseling test, where we talk about the meaning of the result. Let's say she's negative. You have to counsel her on negative result. That yes, she's free does not mean that that the chances of not gay is not there. No, you really have to go forward to later. In the next 3 months, we're going to do other tests to confirm. Then where it takes positive, we are going to take other steps. So these are the things we are going to be looking at in details in this case of Mrs. So in the latter part of this discussion, we were going to dwell more on the voluntary counseling, testing, and the post-counseling test. So as part of the investigations you are going to carry out with HIV counseling and testing, then also look at sexual health education, and where we'll talk about information on related to safe sex practices, including proper condom use and all of that, and the importance of having a monogamous relationship or a consistent partner. This needs to be re-emphasized during the section. We really need to talk about that in details. Then you also have to talk about other sexually transmitted infections which you might be exposed to, like syphilis and hepatitis B. You really talk about that, and you need to discuss that. So as part of things, you will have to talk with her during this antenatal section. And their chances of creating a problem in the pregnancy outcome. We'll have to talk about that and all of that. Then also talk about vaccinations and preparation, because no, she came for antenatal care, preparation for delivery, birth planning, and the complication readiness. We'll have to also discuss with the woman about birth planning, the type of birthing she would want, cesarean section, normal child, vaginal delivery, and all of that. They have to educate her on signs and symptoms of labor, and also prepare her for the motherly role, you know. So you have to also talk about referral areas, should in case her condition gets complicated along the line during the management. Then you can also talk about postpartum planning. Postpartum planning is very key in providing a good antenatal care. And now, based on this case scenario, we are suspecting that chances of Miss Ebuna coming down with HIV. We are actually suspecting that. So what do we do? That is the next we're going to be discussing here in this discussion. So looking at that question, describe the essential steps that you should take in providing antenatal care. Look at the overall steps that you should take for normal person, for a person without any risk. Now, Ms. Ebuna is already exposed, and her behavior is actually a risk for her to actually have exposure to HIV and other STIs. So we are going to be looking at more texting, counseling, and interventions. I already know that intervention is PMTCT in order to eliminate mother-to-child transmission of HIV, should in case she's tested positive. You understand? So now you will have to carry out pre-test counseling, and there are basic informations you must provide to Ms. Ebuna for her to understand. The first is you will have to let Ms. Ebuna know how HIV is being transmitted, the mode of transmission, and how it can be prevented. Mostly through sexual intercourse, through blood transfusion, through a needle stroke, through pots that are exposed to infected blood. You need to let her know about these methods that HIV can be transmitted. So then, and how it can be prevented through safer sexual practices and early identification of mothers who already have the HIV so that they don't transfer it to the baby. You have to also let her know, and also screening of blood before transfusion. Then avoid sharing piercing objects and sharps. You also have to let her know about the mode of prevention. These are pre-test counseling. You understand? Okay. Then you also have to explain to her that the risk of HIV transmission to the child, if the mother is positive, is usually reduced to less than 5% if they adopt PMTCT. And what is PMTCT? Prevention of mother to child transmission of HIV and HIV to the child. You have to let her know of this. So you also have to, during that test counseling, you also have to let Ms. Sebuna understand ways to prevent mother-to-child transmission of HIV, which include early identification and the initiation of antiretroviral therapy as early as possible to reduce the viral load, then safer birth options, and also practices during postpartum in relation to breastfeeding and all of that. You also have to let her know about that during the pre-test counseling. Then you also have to explain to her how the test will be conducted, which includes a needle prick or collection of blood sample from vein through phlebotomy or venipuncture to collect some sample for the texting. You also have to let her know that the text might require levels of texting, screening, use of the tapag, gold, and some other Western blots or immunosorbent assay test or even PCR test. You also have to let her know that and the meaning of the result as well. Then also reassure her that the result will be confidential. It is important. Then explain to her that she can refuse the test if she changes her mind and can take the test later. But however, tell her the risk of not identifying the status on time, a risk to the newborn, the baby she's carrying in utero, that the baby chance of getting the virus will be on a higher side. You need to let her know about that. Then you text her. The next is texting. We've talked about the pre-texting. Now you text her with any of the recommended texting options. And let's say she texts negative, you also have to carry out post-test counseling for negative. You really have to explain to her the meaning of the negative results and the importance of her remaining HIV negative throughout this pregnancy. So you have to also rediscuss again with her the ways of preventing HIV, which I've already discussed with her during the first pre-test section. Then you also have to discuss risky behaviors and the need for protection, particularly now that she's pregnant and during postpartum period. You need to let her know that she not using condom is a big risk. Okay, and having multiple sexual partners is not encouraging and can expose her to the risk. So you really have to discuss that with her in details. Then encourage her to return back in the next 3 months for retexting or before the delivery. Before the delivery, she needs to be tested again. Okay, and if possible, encourage her to come alongside with her partner for her partner to be tested. Then give her some condoms that she can use when she returns. Now, let's say the woman is positive. You have to explain the positive result to her, the meaning. Tell her that higher text will also be carried out to confirm the status. All right. Then provide emotional support to her. You really have to provide emotional support to the woman because of the meaning of the result. You really have to do that. Then also explain to her that she has a good chance of staying healthy and well for a very long time throughout this pregnancy and can have a child whose chances of having the HIV will be reduced to 5% if she continues to come for the scheduled clinic appointment and adherence to the antiretroviral therapy that will be given. And if she also follows the advice you're going to be given to her. Then you have to explain the concept of the PMTCT, which is the prevention to mother-to-child transmission of HIV. You have to explain that PMTC intervention. Telling her about the importance of the antiretroviral drugs, the varabin, the all of antiretrovirals that will be prescribed from time to time for her to take. Then also have to explain that about prophylaxis using cotrimoxazole for her child and all the possibility of continual interventions. Also have to stress the importance of her keeping to follow up visits before and after the childbirth. You need to also discuss that. And lastly, um, I'll talk about uh, her bringing her partner to the clinic. So this is the essential steps a CHU should take in providing antenatal care to Ms. Ebuna, including appropriate texting, counseling, and intervention. The core intervention is PMTCT, and the PMTCT has to do with giving antiretroviral therapy as early as possible, taking and monitoring the viral load, taking options of birth based on the viral load. We can go for CS if the viral load is high, with the woman is at what we call higher risk mothers, we can go for CS. Then also other precautions during the birth, then after the birth, breastfeeding and all of that, interventions, and the giving of the child antiretroviral for the first 6 months of life and other recommendations. So you will have to discuss PMCTT in details with her. I think we now one of the sections we actually discussed ART for the newborn. We have a section here, so you can look up for that section and take it as important. So when you ask this in the examination, we expect you to actually dwell more about general assessment for antenatal history taking, physical assessment, laboratory investigation to rule out hepatitis, syphilis, and other STIs because she's already exposed. Then talk about HIV, PMCT concepts, and intervention counseling. You will have to actually discuss at least on this briefly. Okay. Then also talk about breastfeeding options and all of that. You also have to talk about. Now let's take the next question. Say, explain the importance of partner involvement in Mrs. Ebuna's case and outline the strategies the healthcare provider can use to encourage partner testing and support. It is important that the partner get tested. So it's here that we want to know the steps you're going to take to encourage her to actually involve the partner in this case because it is necessary and important and vital to a better outcome. Now, why we'll talk about the importance of partner involvement is this one. If the partner is involved in this case, it will help ensure that the potential risk of STIs are all addressed. You know that STIs increase chances of HIV. Yes, they actually increase chances of someone contracting it from a partner. So if the partner is involved during this case management, it will actually help improve the health of the mother and the baby. The partner can now encourage the mother to actually stick to the antiretroviral pills and also follow up and other appointment. Yeah, so that's one of the important. Then also when the partner is involved, it can help reduce stress towards the mother. The mother, emotional stress, anxiety, and fear would be reduced, and so that the pregnancy outcome will be good. So that is why you need to involve. Then also that's what we call shared responsibility. When the partner is actually involved, there's a sense of responsibility of the baby's well-being. The father knows this is my child, and it will help in making healthy decisions that will actually lead to a better pregnancy outcome. That's another reason. Another reason is that there is risk reduction. Since the partner will be aware that this is the status of the mother or his own status, so certain behaviors and lifestyle that is exposed to sexual risk will be actually reduced. That's another importance. Then talking about strategies that could be used to encourage partner testing. One of them is open communication. You have to be open. You have to create a welcoming environment. You have to actually have an open communication where you create an environment that will enable Ebuna and the partner to feel comfortable, you know. You also have to encourage Ebuna to share her concerns with her partner. So when there's open communication between the health worker and the Miss Ebuna and the partner, and open communication between the partner and Miss Ebuna, it will actually encourage the partner to test himself or get tested rather. Then other strategies include education sections. Actually, a book and education sections where you're going to teach them about HIV, how it's being contracted, how it can be taken care of or managed, and the likely risk of not being tested. You will have, when you do that, that will actually lead to a better outcome, and the partner can get tested. Then you can also adopt joint appointment. You can encourage the partners to attend antenatal appointments together. This will enhance the partner testing. Then you can also go on with supportive counseling. You can also carry out supportive counseling for them. Then you also can adopt addressing their fears and stigma. You really have to do that. You really have to do that. You address their fear and stigma. When you do that, that will help them to be comfortable, feel relaxed, and get it. No one wants to get that big diagnosis. Even me. When I go to the hospital, I'm scared of you telling me that I have hyper, But when you actually let me understand, you understand. So I will actually give it. So it's always good to encourage them and have an open communication. Allay their fear and anxiety. And yes, HIV is not a death sentence. Many persons are living with it. If we do that, there will be the partner will be much open to accepting the testing. So that's the questions. Let's look at the next question. It says, which of the following is a significant risk factor for sexually transmitted infection in Mrs. Ebuna's case? 1, her age. 2, her second pregnancy. 3, multiple sexual partners. 4, inconsistent condom use. The major one here is the inconsistent condom use, because actually, yes, we know that her age, being at risk as within the age of mothers of childbearing age, exposure to other risk. But if she actually used condom in all her sexual activity appropriately, the chances of coming out with the virus will actually be reduced. So that is the first and the most significant risk factor, followed by multiple sexual partners. Then at her first and AIC visit, which test should be offered to Ms. Ebuna? HIV viral load, CD4 count cell test, HIV antibody test, HIV DNA PCR test. The one that's obtainable, or always called the screening, is the determine and HIV antibody test, trying to see if the antibodies have been developed. Okay, you might not actually find the viral load, but the antibodies are first detector, so it's usually being carried out using the determine. Then, if Ms. Ebuna tests positive for HIV, what is the primary goal of antiretroviral therapy during a pregnancy? To cure Ms. Ebuna's HIV infection, to improve Ms. Ebuna's overall health, to prevent mother-to-child transmission of HIV, to prevent Ms. Ebuna's from getting other HIV. Well, all of these are actually the goals, but the most important one is because she's pregnant, we don't want to allow the child to get the HIV. So to prevent mother-to-child transmission of HIV. Then, which of the following is the most appropriate counseling topic for Ms. Ebuna at first antenatal visit, given her history? 1, says the importance of exclusive breastfeeding. B, the benefits of cesarean delivery. C, risk reduction strategy in HIV and STIs. The management of labor pain. well, looking at here, now the most appropriate counseling topic for Miss Ebuna at her first antenatal visits, based on the history she told us, is risk. Is topic that talks about risk reduction strategies for HIV and STI, so that she doesn't expose to more virus. Then, what is the recommended approach to partner testing in Mrs. Ebuna's case? Test the partner only if Ms. Ebuna tests positive for HIV. Test the partner only if Ms. Ebuna requests it. Encourage and facilitate voluntary partner testing. So the best option here is to encourage and facilitate voluntary partner testing. So when you adopt those strategies, you can easily actually encourage her through open communication with partner, and the partner will actually submit for the test voluntarily. Then when you also allay the fears, anxiety, when you encourage supportive counseling sections, the partner would likely go into text. They say Ms. Ebuna is diagnosed with HIV. Which of the following interventions is most critical for preventing transmission to her baby? Nutritional support, stress management, antiretroviral therapy, exercise. This antiretroviral therapy is the correct option here. If Ms. Ebuna is found to have syphilis, we won't talk about syphilis here. Syphilis also goes with that virus, because they're all sexually transmitted. We won't talk about it, but I think in the other sections we'll talk about syphilis. So if she if she has syphilis, what treatment is recommended? The first option says aciclovir, second one says azithromycin, the C option says benzodiazepine penicillin, and the D option says ceftriaxone. The correct option is the normal treatment is use of benzodiazepine penicillin antibiotics. The next is what is the importance of providing Ms. Ebuna with comprehensive antenatal care, including HIV and STI prevention and management? One, to ensure Ms. Ebuna has a comfortable pregnancy, to reduce the cost of healthcare, to improve maternal and infant health outcome, to shorten the duration. So the actual option is to improve the maternal and infant health outcomes. So with this section, we've been able to look at this first case scenario of Mrs. Ebuna. So I encourage you, as you're preparing for this exam, kindly look at these case scenarios. Look at HIV. What is HIV? HIV cycle. What is HIV? HIV cycle. Laboratory investigation for HIV text. Prevention of mother-to-child transmission of HIV. Look at nutritional support for people living with HIV and AIDS. Then also look at management as part of PMT. In fact, dwell more on PMTCT. Do not ignore all of these areas. Dwell more on PMTCT in terms of voluntary counseling and testing, delivery option, treatment, postpartum for the baby. I think we have a session that explains more on that. So you have to also give attention to these areas I actually have talked about. Do not read more on our 10 paper now. We're not going to have that in our section in these exams. Or look at PMTTC holistically, look at it. Then look at people living with HIV and look at HIV, a cycle, laboratory investigation, and look at ARV, types of ARVs, antiretroviral drugs. You really have to look at them, and then counseling for them. You need to also look at that very well. So I wish you all the best in the forthcoming examinations. All the best. Thank you very much for your audience. Thank you, and have a wonderful day.